Welcome to The Buzz by Dr. Z. I'm Christine Stragala, and joining me today is Dr. George Solupko of the Lung Specialists of Central PA and the Altoona Lung Specialists. Welcome.
Thank you very much, Christine. Good to be here.
Thank you for being here as well. And today we're talking about shortness of breath. Would you say that's the most common complaint you hear?
Actually, Christine, it is. It's the most common complaint that brings patients to our office. They come for shortness of breath, and then we work them up and find out whether or not they have lung disease or some other particular problem.
And exactly how do you treat someone that has shortness of breath?
Well, it starts by taking a history, of course, why they got short of breath, when it started, and then there are a lot of other things about it, what they did for a living, do they smoke, personal habits, things like that. And then, of course, some of the testing that we do also helps define their shortness of breath complaint if it's due to a lung disease.
Can you tell me a little bit more about the tests specifically that you do?
Well, the tests are very easy to do. We have them blow into a machine to measure their airflow. We check their oxygen level. We often do a chest x-ray and sometimes a CT scan. So these tests are very non-invasive, and they're very easy for the patient to tolerate.
So once you complete the tests, exactly how do you treat them?
Well, it depends on their lung disease. Most of the patients will require some medication, particularly if they have chronic obstructive pulmonary disease, which is our most common disease that we see. And then we oftentimes give them some things to do to change their behavior. We have to get them to stop smoking. We have to get them to lose weight sometimes. Sometimes we send them for rehabilitation, where pulmonary exercises are performed to help them improve the general working of their body to help relieve some of the shortness of breath.
And as far as exercising is concerned and those treatments, do you have a good response rate?
There really is. The patient has to be involved. This is not just something that we do for them, that they have to do something for themselves. So yes, we do get a good response rate if we have a cooperative patient.
Well, certainly I'd like to thank you for joining us today.
Sure, it's a pleasure. It's an absolute pleasure.
Dr. George Solupko, and we look forward to The Buzz with Dr. Z coming up next month.